like now recognize the gentlelady from Michigan, Ms. Dingell.
Thank you, Mr. Chair. Thank you for holding this important hearing on a range of critical public health topics, including the over-the-counter monograph drug user fee program that's expiring this year. I'm very proud to have helped lead it with my colleague Dinah Dingell and my two colleagues on the other side of the aisle in a bipartisan effort to create the program and its enactment in the CARES Act. Through discussions involving members, patients, doctors, pharmacists, and advocates, I'm glad we were able to take the first step towards reauthorizing OMUFA before it expires this year on September 30th. But as we work towards a reauthorization that will improve access to safe, effective, over-the-counter products, I'm very concerned about the ability to implement this reauthorization without a strong FDA workforce. In April, more than 3,500 FDA employees were laid off, a roughly 15% reduction in force. Secretary Kennedy has announced that he would reverse a portion of the broad cuts without specifying how this would occur. Firing key drug safety officials in the name of efficiency, I believe, is short-sighted. It's not the way that our healthcare system should be run, and that it risks American safety. The Trump administration has stated that anticipated cuts to the FDA workforce will not affect product reviewers or inspectors. Even if these positions are spared from terminations, gutting the agency workforce leaves them with more responsibility and fewer resources. The idea that they will not be impacted is simply not realistic, especially when the FDA is already understaffed and behind on inspection deadlines. Dr. Corrigan-Curray, I understand you can't answer questions about RIFs, so I won't put you in the position of asking you a question on that specifically. However, we do need to ensure the agency has necessary staffing to enable product evaluations without compromising FDA's dedication to scientific integrity, public health, regulatory standards, patient safety, and transparency. The user fees are central to that. So what I will ask is the impact on staffing if this program is not reauthorized on time? For example, what happens to staff in the workflow and availability of patients?
Thank you for that question. You are correct. If this program was not authorized on time, approximately 44% of the scientists, reviewers, and others working in this area would have to be terminated. And what would happen is we would stop meeting on development programs. The proposed orders we have out, including the one on changing the dosage forms, would not get done and delay the new sunscreen that we're trying to work. We would miss those deadlines and we would fall back on the innovation that we're working on.
Thank you. So my colleagues, we've got to work together on this. As a co-chair of the Skin Cancer Caucus, I'd like to turn to the issue of sunscreen regulation and recognize we have skincare patients and advocates in the audience today. Thank you for being here and for your advocacy and dedication to the cause of skin cancer prevention. I have introduced a bipartisan bill, the Safe Sunscreen Standards Act, alongside my fellow co-chair, Representative John Joyce, which would streamline the FDA review process of the effectiveness and safety of new ingredients for non-prescription sunscreens. But we do want to make sure everybody's safe. Sunscreen is critical in the prevention of skin cancer, yet there are concerns that the current FDA regulations regarding sunscreen active ingredients aren't sufficient. There hasn't been an approved new active ingredient in sunscreen since 1999. You can go to Europe, you can get much better product than you can get here. Dr. Corrigan-Curray, I first want to get your opinion on the current situation of the sunscreen testing requirements. Do you see opportunities for Congress to act to alter the requirements on testing to increase the available active ingredient list?
Thank you for that question. I think we're willing to work with you on legislation. We do want new sunscreens on the market. We want to make sure they're safe. We do have a new product. The first OMAR was for a sunscreen, so we hope that, perhaps we'll break that 1999 record. But, these are drugs, and when we see that they're systemically absorbed at a rate that they could have systemic effects, we need to evaluate that, and we're willing to look at ways to evaluate it, provided we get the information that will allow us to determine it's safe.
I'm going to submit more questions for the record because I'm out of time, but I do think we've got to figure out how the FDA balances health and environmental concerns with the need to access the most updated sunscreen technology and medicine. So I'm going to have questions for the record and yield back, Mr. Chairman.
Lady,